nice guidelines, but in states they are, and this is something available to all of us. It's not hugely expensive, and the combination works through the JAK pathway. So that's something we can think about, because in our treatment, in our resource restricted environment, these are the alternatives we have to think about. And you can see most of them, these publications come from India. And this was the sort of treatment they've done. They have used azathioprine for this patient, but then they switched it over to leflunomide with anthralin, and you can see, sorry, the dose was stabilized at 20. Now, out of box, we have to think out of box. When I started in pediatrics itself, they were hygiene therapy, saying the kids needs to, if they've got always clean environment, they will have more sort of allergic component, and Americans don't just think about the ideas, they do explore it as well. I'm sure once we have more resources in Pakistan, we will do the same. So this is FDA approved, and that's what I wanted to put it across here. Mother dirt. So this is they have taken the dirt from the soil, and it's live probiotic spray for eczema actually. So you can see where when people start thinking outside the boxes, they can have new breakthroughs. This is another thing. This is again for eczema coming up. This is not a conventional treatment, but this is again FDA approved. This was discovered in New Zealand recently, and this is a chief pharmacist, not a doctor, a chief pharmacist working in their labs. They just thought, why don't we do peptidization, which is a patented process, and the bee wax they have used, and then some plant extracts, and it works fantastically well, and this is FDA approved. So obviously it is available in states as a treatment. Now bacteria therapy, NIH, National Institute of Health in states, they are working on that as well, and this is, you can see this is from May 2018. So most of the options now, rather than using antibiotics and other things and steroids, and now obviously there are other treatment options or venues we are exploring at the moment. Now, we did heard about Dermovit a lot. Now, Dermovit has got a, I would say, brother or sister coming up. So this has just been licensed in November. Yes, that was in November last month in states, and it is equivalent to Dermovit strength new steroid, halobetasol. Now, just to mix a few slides, and the Monty cast people, when I go across in the UK and present to my primary care pediatricians and physicians, they do ask, does Monty cast have any effect on atopic dermatitis? Well, this month, last month it was published, no, there is no. So, at least now we know that. And but atopic dermatitis, if not treated in the young age, unfortunately increases the cardiovascular risk, so MIs and other problems. So you can see this is a study for 400,000 adult patients, and it was matched as well in 1.5 million matched controls. So there is increased risk. So if we don't treat someone now, a child now, obviously in the long term, we are increasing their risk for cardiovascular disease. So think about, that's the reason we have to think about all these opportunities to build up a specialty or a training in Pakistan. Autoimmune and systemic diseases, as I mentioned, this is a JAK inhibitor. This is licensed in pediatric alopecia areata in September in states. So, but again, this is hugely expensive. The other option is using anthralin with leflunomide. Psoriasis, we always in my clinic, when we sort of educate a patient, we tell them, oh yes, stress is a sort of a flare-up cause for psoriasis. But if you see here, and obviously this was for my education as well, recently this year we have there was a study suggesting that there was lack of impact of stress on psoriasis. So we cannot now continue to say that to our patients. I think this is possibly one of the last slides, but this is for skin cancer. And the reason I put it up here for my colleagues, because methotrexate, low-dose methotrexate has long-term skin cancer sort of association. So we have to think about these when we are giving this to our patients, whether pediatric or adult, doesn't matter. Then Where I practice in UK, we see a lot of melanoma, SCCs, BCCs. We have a weekly MDT for skin cancer, and we always debate on, consultants around the table have debate on this. You know, what's the margin, how much is excised, how much not, and this is coming from that November 18, the publication, that even if it is a mildly or moderately dysplastic nevi and it's been excised, you don't need to worry about the margins. Because there is very low risk of recurrence in the same site, but it's usually you have to look at the other sites of the body. Then sunscreen for melanoma, as Dr. Mahmood mentioned previous to me, this is a study again suggesting that melanoma prevention is in pediatric age group. So, this is 600 melanoma cases and 1100 controls in Australia, and you can see it was during childhood the higher exposure to the sun actually increased the risk rather than adulthood. So we have to educate our kids about this as well. Now, sirolimus for prevention of skin cancer. When I was in Great Ormond Street, sirolimus was very newly inducted, 2012, 13, and 14. But now it's being used left, right, and center. Everybody's using it. So even for post-kidney transplant patients, to reduce the incidence of skin cancer, SCC, sirolimus has worked. So this is obviously a publication recently. There are many more venues for sirolimus actually, and let's see what future has for us. Last slide, you can see doxycycline in children. We don't use it in younger children because of the sort of enamel discoloration, but this is FDA approval now, American Academy of Pediatrics approval. If you have to use it for under 21 days, you can. So that's been changed now. And then again, biologic agents like adalimumab, long-term safety in hidradenitis, you can actually use it. And there has been etanercept for Steven Johnson's as well. And I think that's my references. Thank you.